Good afternoon. My name is Laura Burbano. I am the admissions advisor for this performance psychology and clinical mental health counseling programs. Welcome for joining us today. Just give you a couple of instructions regarding this open house. So for today, we're going to have in our panel, Dr. Michelle Rose, Dr. Amy Ohana, and Dr. Sarah Castillo. So Dr. Sarah Castillo and Dr. Michelle Rose are the program directors for our combined degree in sport and performance psychology and clinical mental health counseling programs. So if you have any questions at all about those particular programs, you can start typing them in the chat box. We also have Dr. Amy Ohana. So she is a faculty member from the Department of Clinical Mental Health Counseling program. So if you have any questions about a master's in clinical mental health, please direct those questions to Dr. Michelle Rose and Dr. Amy Ohana. So I'm going to ask at this point Dr. Rose, Dr. Ohana, and Dr. Castillo to please join me in the session for today.
Hi, Laura. Hi, everybody. Thank you for joining us.
Hello.
Hi, everyone.
Excellent. So thank you so much again for joining me. I know it's kind of a hectic day for various reasons, but I just wanted to sort of like use this time, if any of you can sort of like introduce yourselves a little bit for our applicants, let them know your specific role. And then I already am getting so many questions before this open house from applicants asking specifically what are you looking for applicants specifically for our sport and performance psychology and counseling programs.
I'll start since I'm unmiked already. Hello, everybody. I'm Dr. Michelle Rose. I've been with the university now for a little over 5 years. I started the clinical mental health counseling program and have been delighted in the last couple of years to work with Dr. Ohana as an expert in the field of clinical mental health and Dr. Castillo, who's an expert in sport and performance psychology. Our goal really here is to answer the call of educating those who are really compelled to improve the mental health of people around the world, around our country, and in particularly related to the integrated degree to really focus on mental health for athletes and performers, anybody really who works at an elite level and feels significant stress and pressure to accomplish or achieve, because we know their mental health is impacted significantly by that drive, but also that they suffer from mental health disease and disorders at the same rate as the rest of the population. Even though I am the director of the CMHC program, I feel super honored to have probably the best educator I've ever worked with on my team. That's Dr. Amy Ohana. We've had the opportunity to work together at a couple of universities. There's not a question she can't answer about our program, our students, and our university. So I'll hand it over to either one of you two and let you guys chat a little bit.
Well, I'll go. Sheesh, I'm just glowing from that compliment. Thank you. I'd have to say Dr. Rose is a fine educator too, and Dr. Castillo. So I'm Amy Ohana. It's great to have you on the webinar or Zoom call today. First and foremost, I love what I do. I love my work. I couldn't imagine doing anything else. And I think that is true of our faculty in this program. And I think that's what makes the difference in this program is that we teach because we want to. We could make a lot more money in practice, I can tell you, but we are educators because we're passionate about teaching and training. I've been a counselor educator almost 20 years. I'm a licensed professional counselor in Oregon. I'm the author of 3 books. I research as much as I can. I'm fascinated by new theories and concepts and constructs. And then this year, my connection at UWS really inspired me to begin my own study in sport and performance psychology. So within a year, hopefully I will have my graduate certificate in SPP and be certified as a CMPC's certified mental performance consultant. So that's an aggressive goal, but I'm going for it because, hey, this is all about performance, right? So, so that's me, and I'll turn it over to Dr. Castillo.
Always love a convert. I'm Sarah Castillo. I'm the director of the Sport and Performance Psychology program here at UWS. I've been here for almost 2 full years now. And it has been a real joy to figure out sort of how to continue to grow our program and how to strengthen what we're doing. To add a bit to what Dr. Rose was saying, I really want to kind of put out the program philosophy overarching both of our CMHC and SPP programs. And that is the idea that mental health is a continuum. When someone says that you're a mental health provider, it does not solely mean that you're working with clinical issue. It also encompasses the performance side. So all of us consider ourselves to be mental health practitioners, although we work on different sides of that mental health continuum on different reigns in that spectrum. So we really want you to take forward that is the work that you're doing. And because of that, there's so much importance on knowing the boundaries, the regulations, the ethics codes, what crosses and what doesn't, where your competencies are and where you're stretching a little too far. It's really essential for us to define that continuum for all of our students and help them understand where their training allows them to be. So that's sort of the overarching philosophy. In terms of what we're looking for, to address Laura's last question, I think, again, Dr. Rose and Dr. Ohana have hit on it pretty well, right? The answer is passion. Certainly we want to make sure that the academics are there, that your strength as a writer, that your passion for research, that your strength as an academic is prominent in your file and in your application, but really finding this work as more of a calling than something that you think is cool, right? Sport and performance psychology is incredibly sexy, and the Olympics come around and we get great stories. We get Simone Biles, and wouldn't it be great to have helped her? We get Naomi Osaka, and wouldn't that be fantastic if I could work with someone like that? And all of that is incredibly cool, right? We get to talk about all the Major League Baseball teams who have sports psychology consultants and internships and opportunities. And that's true. It's very, very cool and very, very sexy, but it is very, very challenging. Those people that work in Major League Baseball spend about 20 minutes a year at home. I have a good friend who missed the first 7 years of his daughter's life. When he came home after baseball season, he was a distraction to his family because they had routines all set up, and being gone 9 months of the year in a Major League Baseball season meant that he had to sort of come in and be an observer in his world. So I want you all to consider that why you want to be here is not because it's cool and not because you used to be an athlete, and it's none of that. It's because the passion that you have inside and the real draw that you have toward improving and collaborating with performers to help them maximize their potential is the strongest calling that you have. That passion is going to show through in any interview and any application that you have. So that's really our focus.
Thank you so much, Dr. Castillo and Dr. Rose and Dr. Ohana, for those answers. So the next question has to do specifically with the differences between a certified mental performance consultant and a counselor. So we get in admissions tons of questions about the differences in terms of the scope of practice between these two professions. So we would like to know if there are similarities or if they're completely separate, these two professions, counselors and certified mental performance consultants.
I'll start. In the majority, people with mental health counseling degrees, those pursuing licensure and those who are licensed, are focused on assessing, diagnosing, planning, treatment, and treating mental health disorders. Although we get sometimes in our offices what are called the worried well, people who don't meet a diagnostic criteria, and we work with those folks toward improvement of their life circumstances. We're really focused on understanding the brain and how that creates mental health disorder and how to improve functioning in life.
When it comes to the mental performance side, again, keeping that idea of a spectrum or a continuum in mind, mental performance is sort of the other side of that. And so we're looking at folks who are operating within the range of what we would call normal or sort of stable performance. People who are surviving well on their own, and moving them into the realm of exceptional performance and thriving. The difference is not whether or not a certified mental performance consultant or a clinical mental health provider can recognize symptoms of mental disease and disorder or shepherd somebody through the process of understanding what's happening to them. There is no treatment of mental health disorder with a CMPC. That's not what the certification is for. That's not what it allows you to do. So Dr. Ohana spoke a bit about adjuncting her current licensure with this certification. What that does is it allows her to do both things, but those are never combined on the same individual. Dr. Ohana is not going to have one individual and one day she puts on her clinical hat and now we're talking about trauma and past life experiences. And then the next time she puts on a different hat with the same client and we're going to work on a mental skills intervention for track and field. This is not how it works. When you are working with a client, you are wearing one hat the entire time. And so if Dr. Hannah, even though she's trained in both fields, begins working with a client in mental performance and that client presents with a clinical issue, Dr. Ohana refers to a clinician, not because she can't do the work, but because ethically she's prevented from doing that work. And the same thing vice versa. So being dually trained is fantastic, and it really does give our students the opportunity to do both as part of a holistic practice. But there are very strict lines between who you are and what your role is with a particular client. I hope that makes sense and answers a little bit.
Yeah, thank you so much, Dr. Castillo. Dr. Ohana, you want
I was just going to add, actually, I'm teaching personality and counseling theory this quarter, and this question was exactly how we opened our first synchronous Zoom class connection today, actually. And I would say, as someone who teaches counseling theory, as well as someone who's now taking sport and performance psychology theory, the theoretical foundations for both fields are slightly different. And that then leads into this trajectory of application, intervention, and treatment. And I would not use the word treatment for SPP work. I would use the word intervention or mental skills training. So you can see that the foundations are similar, but they're different, leading to different licensure and different outcomes as far as what the practitioner actually does.
Thank you so much. That was wonderful. So the next question has to do precisely with online learning. So our applicants want to know if they will have like an edge by taking these programs that are fully online, or if there is something that is to their disadvantage because of the programs being 100% online. The concern that some applicants have here is in regards to the clinical hours, the pre-practicum, and the mentorship experience. So if each one of you can talk a little bit about that, it will be wonderful. Advantages, disadvantages of online learning in our programs in regards to clinical, mentorship, and pre-practicum.
Sure. So I'll tell you, and we have this discussion with all of our applicants, a number of folks out in the world have somehow come to believe that online learning is somehow easier than a traditional in-classroom experience. And as you can see from Dr. Rose's response, that's probably 100% the opposite of what is actually true. So much more is required in terms of intrinsic motivation, in terms of the desire to move forward and make those connections deliberately. Because you're not going to be in a classroom with people at a certain time on a certain day, the cohesion doesn't come to you. That being said, when you invest, I know that all three of us would attest that we have students who have said that their traditional online learning programs did not nearly provide them the same level of connection as they found in their programs here at UWS. And that's truly because not only have we set up situations in which that connection is possible, but because our students recognize that they need to be deliberate about it. We've probably got 6 or 7 different WhatsApp groups, certainly one for every class that goes around when our students go to conferences. Everyone is connected in a number of different ways. We've got essentially a student heat map talking about where our students are all over the country, where our faculty are around the world. So there are certainly opportunities for students to reach out. But again, that the biggest challenge is knowing that you need to be deliberate about making the connections that you want to see. We can only do so much in making those things possible, and then it becomes you taking advantage. In terms of the mentorship experience, and I'll let Dr. Rose and Dr. Ohana talk a bit about the practicum piece. The mentorship experience will not be online. You will be selecting a site and a group of individuals with whom to work in your personal location. So you'll be meeting with faculty, meeting with your UWS mentor. Your supervision essentially will be in very much a similar situation like this, unless you happen to live 10 minutes from Dr. Carrie DeCandia in North Carolina, and you guys can meet at Starbucks for your mentorship sessions in person. But the work that you do will be in-person work. So we'll help you to figure out a site, an opportunity in your current location, and then you'll be able to work, record those sessions, discuss those sessions with your mentor, with your supervisor. So it's very similar to an on-ground program in terms of the mentorship and practicum in particular.
Do you want to go next, Dr. Ohana?
I would echo what Dr. Castillo said. In the clinical mental health counseling program, you engage in your first early clinical experiences through our standardized patient program, which is a trained actor who's providing a very true to life mental health scenario. And then you move into practicum and internship, which are based in the community where you live. And then you undergo pretty stringent clinical supervision, both from your site as well as through the university supervision, 2.5 hours a week, where you are being supervised and you're electronically recording your clinical sessions, which are reviewed by your supervisor and by your peers in a group format. So I'll turn it over to Dr. Rose and she can explain a little more about that.
I will tell you honestly that 10 years ago, I was probably the biggest naysayer of an online counseling program. I did not believe it was possible to do it well. And then my husband at the time got ill, and I needed to find a way to make a living at home while I was caring for him. And I learned the hard way that teaching online and providing information to people online was its own specialty. It requires a different way of communicating, the provision of more resources and information than most people would get in a typical classroom. We needed to make sure that resources existed 24/7, so people had access to them at their convenience. all the way down to the way I phrase sentences and write emails and directions to assignments, which need to be in a little bit friendlier voice, a little bit kinder, gentler, and softer. When COVID hit and so many landed universities had such a struggle converting so quickly into online formats, we then sort of had that hit again where people thought, oh my goodness, online learning could be potentially disastrous. Well, it wasn't for us. In fact, our programs flourished during that time because we had already spent years becoming experts at how to design courses and experiences for students that were thoroughly engaging. And because of that, I'm super proud to say this is probably the most organized, rigorous, thoughtful, approachable program that I have ever been part of. So I'm really proud about that. To Dr. Ohana's points about the way we prepare you for practicum and internship in the field, as part of that pre-practicum course where she mentioned our use of standardized patients, we also use a platform called Skill Setter that allows us to watch you engage in pre-recorded momentary sessions. So they might be like 10-minute long sessions where an actor makes a comment, let's say about suicide, and then you record yourself and how you would respond to that client. So we get to see specific skill sets and provide you immediate feedback about those skill sets as well. And then finally, part of that class is the preparation for you to locate an agency or a site in your community. That's a lot of work. We teach you how to prepare a counseling specific resume, how to answer interview questions from a counseling perspective, how to prioritize the sites or types of sites and client populations you would want to work with, down to how do you craft an appropriately professional email inquiring about an internship. And so we're really there every step of the way. And then when you locate a site or receive an offer, it's our job to come alongside and determine that those professionals are qualified to supervise, that we have vetted them appropriately. We create affiliation agreements with the site. And then once approved, we allow you to do your work on that site. And this is important because counselor licensure is state specific, meaning I can't counsel somebody from a state in which I'm not licensed. So we really want you to learn that and practice with that sort of ethical awareness that you should only be working with people in your own state and community. So we try to do everything we possibly can to ensure that your community-based internship is professional and sound. To that end, we have not yet had one student who was unable to complete their practicum or internship in their state, which I think is pretty exceptional.
Thank you so much, Dr. Rose. So the next question is specifically about the concentrations in the standalone doctoral degree in sport and performance psychology. So Dr. Castillo, if you could please explain to us a little bit of a person who is interested in positive leadership and administration, that particular concentration. So what kind of job they will be able to have?
Sure. So we have, as Laura mentioned, we have two specific concentrations in our standalone doctoral degree. The one of them is sport and performance psychology consulting, in which you do your mentorship toward that CMPC certification that you've heard about. The other, as Laura mentioned, is our positive leadership and administration concentration. Really, that concentration is for folks that are really looking to expand their current career, either in athletic administration, in coaching, who essentially want to use their degree in ways other than becoming a full-time sport and performance psychology consultant. We've had folks that have been, as I said, athletic directors and academic administrators. We've had folks that have been longtime coaches and are really just looking to expand their own professional development. The positive leadership and administration concentration depends on the principles of psychology and positive psychology developed by Martin Seligman, and really expands into how to use those principles to enhance motivation, to enhance productivity, to enhance performance in areas like coaching, in leadership and business opportunities, in administrative settings. We've got folks that come into sport and performance psychology because they recognize that the principles that happen with athletes, the things that we use with athletes, actually apply kind of everywhere. And so they're really looking to use what they're learning to expand their role in larger organizational settings as well. The PLA concentration is also a lot of choice for our returning professionals who are looking to get their doctoral degree, but already have that CMPC certification, or they've been pursuing it post-masters and really want to, again, expand a little farther into doing some leadership training, into really being able to market themselves with expertise in a number of different areas. So depending on sort of how you want, where you are currently in your career and how you want to expand your career beyond, that PLA concentration is a really nice opportunity for us.
Thank you so much, Dr. Castillo. So the next question is for Dr. Rose and Dr. Amy Ohana, and it's in regards to people who perhaps have a master's in school counseling, but they want to, for some reason, get into our master's in clinical mental health counseling or our doctoral degree, the combined option, sport and performance psychology and clinical mental health. Are they eligible for this degree, or is there any route that they could take if they're interested in maybe getting the clinical license and also a CMPC?
I wish, the answer is I wish, and hopefully in the future that will be the case. Our SPP program has what they call a certificate program. You heard Dr. Ohana talk about that earlier, in which professionals in the field can come round out their education with specific courses. And that's really what would be needed in our CMHC program in order to do that. Otherwise, these existing school counselors would be repeating a lot of coursework. There are significant differences between school counseling and the education of school counselors versus counselor educators, but or of clinical providers, but far and away the majority of the classes are the same. So I could see at some point in the future us developing a certificate program just for that professional transition. And I really appreciate that any of our school counselors out there who are already doing amazing jobs would want to add this additional training for licensure, because I think it's necessary, as the kiddos that are in our schools now are so acute in terms of mental health that we really want to make sure they're receiving all the best treatment possible. So, you know, if you really want to make this happen, we need to hear from all you school counselors who are saying, please add the certificate, because that will help the university make up its mind to do exactly that.
So the next question is coming from an applicant. She's a professional dancer and she works with a lot of performers. So she wants to know if, like, what are the classes that perhaps are available for her in the combined degree?
So in the combined degree now, you'll see that there is a requirement for sort of a course in non-sport populations. There's a class in performing arts, which is really specific to what you're talking about. And then there's another option in high-risk occupations. Those will be the classes in the sport and performance side that are specifically dedicated to that. But I don't want you to think that every other class means you have to talk about sport or you have to dedicate your research, your papers, your projects to sport environments. To be fair, right, the majority of textbooks that you have are going to have an athlete on the front. It's just sort of where the research has come from, and it's how the field has developed. The photos on our textbooks have not actually caught up to where the field has gotten. But I don't want you to let that throw you. We have lots of prior performers. We have professional dancers. This actually might be your question. Professional dancers that I've spoken to in the last 3 or 4 months that are planning to join us, specifically to stay in that field and to really devote their attention to taking these principles and applying them in performing arts settings. So regardless of the course that you're in, you have the opportunity to really specify and focus your attention in that way. The challenge, not really a challenge, but the opportunity will be if the certification is something that you want to attain, 50% of the hours then need to be with athletic populations, and the other 50% can be anywhere you choose. So you can choose to spend the mentorship time that you're doing here with dancers in the performing arts if you like, but completing that certification will take about 100 direct client contact hours in sport and athletics. So it really depends on how you want to meet that requirement if you want to go get certified. But as far as the coursework and where you can focus your attention and where your faculty will kind of guide and support you, you can incorporate your love of performing arts and your past experiences anywhere in our program.
And I will just add, we have a number of current professional dancers in our program, and one recent graduate who gave the most amazing presentation at the ASP conference in Fort Worth in October. So this population, I think you'd have a lot of peers in the program.
Thank you so much, Dr. Castillo and Dr. Rose. So the next question is specifically about professional development opportunities. And we have spoken about the conferences, but our applicants want to know if there are any other professional development opportunities that the university helps them to have when they are students with us.
Dr. Ohana, this is like your wheelhouse.
Well, we strongly encourage students to join their professional organizations. So from the mental health side, that's the American Counseling Association, as well as your state's division of the ACA. So for us in Oregon, it's the Oregon Counseling Association. They are so instrumental for networking, for jobs, for continuing education, just inspiration, and you get to meet people locally. Or at least in your state. From the sport and performance psychology side, it's ASP, the the Association for Applied Sports Psychology. Dr. Rose mentioned the conference in Fort Worth in October. All of our faculty went, and I think Laura, you went too. And we had so many students there, both current and graduated. And it's just a wonderful place to, again, network, connect, socialize. Dr. Castillo mentioned that our students tend to group together and network. They find each other. When I travel, I let students know where I'm going, and I make sure that I connect with them. I just went to Israel, met a student near Tel Aviv for coffee. So we have ways to connect and to develop professionally. Also, our faculty will, based on what we're doing in our own research interests, we will mentor students. We have a thriving dissertation program for the doctoral students. And then what else? What am I missing as far as continuing education? Somebody fill us in.
No, I think one of the things that also kind of goes back to the question of making connections is that in both the CMHC and SPP programs, we have a community hub and a community space. And so anytime the faculty learns about opportunities for either regional conferences, I just posted something today about a free webinar on how aging impacts athletic performance. A friend sent that over and posted that for our students. So anytime there are opportunities like that, those are always posted and available for you. We also post internships and opportunities that way. So we do our best to kind of put as many of those professional opportunities in front of you so that not only can you kind of connect in your area, but you can attend conferences, you can meet with faculty wherever you are. You can really stay on top of what those options are for you.
And I would add just two things to that wealth of information. One is that we start students working on their professional identity development in the first class in the program. That's our ethics class, in which you start to identify what those organizations are, how they help you, what you can learn from them, and how you contribute to the field. We follow that all the way through to the last course in the program, because we believe our obligation is to the development of our profession, not just to our individual clients. Then secondarily, we come from a scientist practitioner model, meaning everything that we do should be evidence-based. We should be able to demonstrate that outcomes that we're suggesting our clients can achieve are possible because of the evidence in the field. And so Dr. Ohana mentioned those research opportunities. We are looking for opportunities all the time to engage with students in research that is publishable in peer-reviewed journals. We're modeling that, and we're mentoring students through that.
Thank you so much to all of you. So we have two last questions. So the first one is specifically for the doctoral degree, the combined degree. So we have the Capstone project for the Master's in Counseling piece, and we also have the dissertation. So our applicant wants to know the differences between the Capstone project for the counseling piece and the dissertation.
Dr. Ohana, that's you again.
Okay, differences between a capstone project and a dissertation. Well, a dissertation takes a year or more, hopefully a year. Capstone takes a quarter. So that's the first big difference. So I'm teaching Capstone now for clinical mental health counseling, and that's the cumulative class for the master's degree. And it basically overviews what a student has learned in their program. It overviews the 9 major learning areas, asking students to demonstrate competency, and then they complete what is called an oral defense, where they have their own scheduled Zoom meeting, faculty attend, they're welcome to invite other people, and they basically defend their work and their learning. And if they pass that, they earn their master's degree. So it is a little anxiety provoking, but it's really more of a demonstration of what a student knows. And it also helps us as a program know to recommend a student for licensure, or know if they've completed all the requirements that they need to become a professional counselor. We also review at that time their internship and practicum hours, if they've met all their clinical requirements, and they have a dispositional fit for the counseling profession. So we sign off on that. And that is the master's capstone. The dissertation, and Dr. Castillo should probably talk more about this, but I can just make general comments. All of our faculty in the College of Graduate Studies are qualified to sit and serve on dissertations and chair them, and we all do, including our adjuncts who also serve as dissertation advisors. A doctoral dissertation is a contribution of new knowledge to the field, and it should result in something that is tangibly shareable, whether it's through a professional publication or a conference presentation, or establishes an area of expertise for the doctoral candidate. It does take a year. It's intense, and as it should be, because when it is finished, it is something that is produced that contributes to the body of knowledge. So I'll let Dr. Castillo talk about more of the specific steps it takes for a dissertation.
Awesome. So all that is true. And really, when we say dissertation, I want you all to think individual independent research project. We will ask you when you come in what you're interested in researching, how you're interested in contributing to the literature. While we understand that ideas may not be fully formed before you're even in a doctoral program, there should be something that you have a passion for becoming an expert in. At the completion of your dissertation, you will be the foremost authority on your topic. Those topics are not going to be big, broad, how does mindfulness impact performance? They're going to be very, very small. How does a 6-week mindfulness intervention with 12 and under youth soccer players impact practice focus, right? Narrow, narrow, narrow. Although a year sounds like a long time, it goes by like that. And the ability to kind of design a study, create a way to collect data, analyze that data, write that data up, it will fly by. We will not leave you hanging. Certainly, you'll have help all the way through the program and kind of creating that idea and narrowing it down to one particular thing that you want to study. You'll have all the way through a discussion of how to create your literature review, how to really incorporate your knowledge of research methods and statistics to an appropriate design to get the results that are meaningful for you and for your research question. And then you'll have a dissertation committee that contains a minimum of 2 UWS faculty members, usually 3, and then an external expert or an external faculty member that is an expert in your particular topic. So we had a student a few months ago who completed a dissertation talking, oh my gosh, Michelle, help me with Ben Frakley's dissertation.
My gosh, see, we moved from one student to the next.
I know.
He discussed the use of ACT theoretical orientation for the treatment of veterans who were experiencing reintegration issues as they come back to the States.
And his external reader was the person who designed the theory, the person who created that therapy.
Dr. Stephen Hayes.
Yeah, Stephen Hayes. So you'll have the opportunity to really kind of branch out and learn all about the area and the topic that you want, but it is an intense experience and it's designed to be that way. It's going to push you to lean into things that you are most likely uncomfortable with. And that's sort of the way our profession works too. There is no easy client and there's no way to become an expert easily.
I will also suggest for any applicants out there who are thinking about this topic or maybe concerned about applying for a program that has a capstone and a dissertation, to maybe reframe in your brain what it means for you at the end of your program instead of thinking about it from the beginning of your program. Our responsibility is to help teach you to become expert in your field. And who you are coming into the program is vastly different when you're at the end of your program. And you've all heard the term imposter syndrome. It's a very popular syndrome lately. And essentially what it means is I'm not really certain that I can be out there acting as a professional in my field if I've really been trained well enough to do that, or if I'm going to feel like an imposter who's trying on the persona of a counselor or a sport and performance psychology consultant. And the reality is, if you leave this program feeling like an imposter, I have failed. Like that's how I feel about this role. And that's why our program is rigorous. So whereas you're coming in as an applicant going, I'm not sure I can do that work or complete those tasks, I would encourage you to place some trust in our program or whichever program you're interested in, to know that the whole goal is to help you demonstrate that you meet the competencies that would be required. I always tell our students at their moment of graduation, you earned this degree. You earned it, and that's what we want our graduates to feel like.
Well, with that, thank you so much, Dr. Rose, Dr. Castillo, and Dr. Ohana for joining me today.